Right, well, hello there. I hope you're well. Um, what are we? We are FLOT chemotherapy for distal esophageal junction cancer. So what are we now? We've finished round 4, and today is day 12. Um, I'm just looking at myself, which I don't do much. Obviously, the hair is rather sparse, but I've never really had much hair anyway. The chemo face is still here. This round, so let's see. I did post on. I think it was day 2 of round 4. I think I was just really not with it at all, and pumped up on steroids, things like that. So yeah, kind of. Since then, it's been a hell of a journey. It really has. I'm feeling, understandably the best I have felt in the last 2 weeks. Although I'm still not well, I have a bladder infection, mouth sores, I still have bowel issues, and I'm tired, very tired. I look tired as well. So I think it's important to rest up a bit more. In the last few days, I've been trying to get out and about and do some walking and walk up steps and things like that to get some leg strength. Given what's today? Today's the what are we? 9th? No, the 7th. seventh of June. I try and figure out what day it is, and yet I've got it sitting right next to me. So it's the 7th of June. So I've really got 5 weeks until the operation in July. So I shouldn't push things too much, I think, and just try and fatten up. Although my weight's okay. Last time I was about 95. Now I'm 96. So, but yeah, FLOT chemotherapy. It's interesting because I think I mean, this week I've got a CT scan which will divulge how effective the chemo has been. I can definitely get food into my stomach. It's not so much the swallowing's been a problem, although with the chemo it tends to aggravate that whole stomach lining, so that can be a problem, and it has been. But now things are starting to settle down. I'm able to. I mean, I had fish and chips for dinner tonight. Yesterday I had a hamburger. Amazing, given that when this chemo regime started 8 weeks ago, I couldn't even sip water, and then I would just get a whole lot of mucus and white, white mucusy sort of bile that would just come instantly straight back up. And of course, that's your stomach trying to help it, whatever it is, go past that esophageal junction, and of course it's just not working. So it comes straight back up. That was awful. So whatever happens and as hard as the chemo has been, I'm expecting some some positive result. I really am. Um, the question remains: if I had to do it again, would I? I don't know. I don't know. It's been really rough. I'm not going to sugarcoat it. It has been absolute hell, and there were times that I didn't know if I was going to get through it. To be honest, mentally, I thought I was going completely insane. I told the oncologist that, and he just said that my red and white blood cell count was strong enough to carry on, and if I could just get through it, it'll be worthwhile. But he said, maybe we just don't do it again, and I don't think I will. At this stage, no. No matter what is happening after the operation, I don't think I can put myself through through that chemo regime again, even if it was a slighter dose. My stomach, the diarrhea, the nausea. No, man, I take all the pills. I'm taking all the pills, but it just hasn't helped. Um, and just to feel like I do in the last 48 hours I have definitely felt unwell, but not as nauseous and running to the toilet all the time. Um, uh, and of course the dehydration and yeah, it's been really really tough. And of course the neuropathy is still there too. I mean the tingling in the hands and the feet. I can't touch anything cold at all. It just stings and burns. Um, uh, Slightly bleeding from the nose. That can't be a good sign, can it? Yeah, look, I'm really not here to try and dribble on again about how I feel, and I don't feel comfortable doing it. But in saying that, I what I am trying to do, of course, is if others who undertake the FLOT chemo regime uh, or have esophageal junction cancer in this area here, should come across this post, then it at least will give you some indication of how someone else is going with things. Because I certainly haven't gone very well at all with it. And as I say, there are times that to be honest, the last 2 weeks have been an absolute blur. I've been so unwell, and just hanging on to try and get through. Let's be positive. Yeah, well, it's almost impossible. And of course, when people say stay strong, it just, God, that annoys me. Stay strong. Yeah, okay. Yeah, impossible. Just you can't stay strong. And is that like a challenge? Is that saying that, be strong? Is it you're not strong enough? Or, but then again, people people mean well. They genuinely do. They don't know how to cope with everything. They want to avoid it, and understandably so, because it's not very nice. But would this be sort of 50 years ago? I would probably be I'd probably be dead. Yeah, I would be. And of course, with esophageal cancer, it tends to spread. The mortality rate is high within 5 years. But I can't really think too much about what's going to happen down the track. I mean, I've got this massive operation coming up, and 480-minute two surgeons. That's a huge undertaking. It is frightening, but I have to get it done, and obviously, and I don't actually. The option is that I go into this sort of palliative care and have chemo every now and again to keep it at bay, providing it hasn't metastasized or spread to other organs. But then it'll just be a matter of time before it does. So you've got to get it out. That's what's got to happen. There are so many things that could be very negative and destroy everything. But as I say, we'll find out when I get the CT scan this week. I asked, why don't I have a PET or a PET scan? And apparently the PET scan picks up a lot of residual scarring tissue that's left over from the chemo, and it's the PET scan is sensitive enough to pick that up, and they can't differentiate between that and cancer. So that's why they revert back to a typical CT scan, which is quite accurate in terms of just picking up cancer markers. So that's why they do that. So anyway, we'll hope for the best on that one. And as I say, at this stage, I'm crossing my fingers naturally that there's not, bad news. Hopefully, it's as positive and working as much as I would hope that it is. And yeah, I mean it's fairly late at night here for me, 7 o'clock at night. So I start to sort of wind down a bit, and I look tired because I am. And we've got a blood test in the morning, and then my scan during the week. So I might post again after that CT scan, and we'll hopefully have some positive news on that one, and then it's just basically a case of getting well and healthy enough for the operation, which as I say, that's going to take half my stomach out, most of the esophagus, deflate the lung, sew it all up. Oh my gosh. Yeah. I mean, after 58 years, your body gets used to the way things are. And I think mentally as well, your brain and your body functions are just so in tune with how things work. And then, of course, this is all going to be very different. So how that's going to adapt will be interesting. But, as I say, if it was 50 years ago, I'd be brown bread. Which, when your time is up, your time is up. So I don't really want to be philosophical. Trust me, I'd rather just not even be in this position at all. But funnily enough, having time to think back with my parents when they were alive, they used to say to me, gosh, you're unwell a lot, Murray. And my stomach, I always had issues, and I was always taking Gaviscon and always taking reflux type of or heartburn type pills, or had stomach issues and felt unwell. I would probably say I felt unwell 60% of the time during the day, and in the morning I did not feel well. And I think all this is, well, so the surgeon said, that all of this is where that stomach acid is trying to come back through that lower esophagus area, and that's always has a propensity to turn cancerous. So yeah, I do remember my dear old mum when she was alive saying, you have problems with your stomach too often, Murray. You should go and get that seen to. And of course, naturally, you don't. You just keep charging on, don't you? Because you think you're invincible, right up until you're not. Yeah, not so good. Anyway, that's it for me today. Mentally, everything has seemed to be coming together for me now. Thank God for that, because I it was almost too much for me, this FLOT chemo regime. Definitely too much. But I guess that's the price you pay, isn't it, for a trade-off. And it's been very, very interesting. Well, that's all. And look, take care of yourselves, and thank you for watching this. And I'll just post a short one when I find out at the end of the week how from the CT scan. They probably won't have the results till the following week, will they? Yeah, that's true. So it might be another bit more than a week before I come back and reveal the results of that one. Anyway, hey, thanks so much, and take care. Thank you.